Hello everyone, and welcome to our first FAQ video on using nicotine patches safely. I'm Troy. I am a citizen scientist and part of the Renegade Research Group. Before we dive in, let's make one thing clear. I'm not a medical professional, so this isn't medical advice. It's just helpful information to guide your conversations with your doctor or healthcare provider. Now, let's talk about safety. It's crucial to do your own research before trying anything new, especially when it comes to managing conditions like long COVID, which can be tricky since there's still so much we're learning about it. These videos are meant to supplement existing safety guidelines and keep you informed with the latest research. So let's get into it. First things first. Always consult your doctor before starting any new treatment. Nicotine gum might seem like an alternative, but it doesn't align with the constant delivery method of nicotine patches. Plus, there are additional risks associated with gum, like exposure to other chemicals and potential dependence caused by the spikes and lows provided by nicotine gum. Nicotine patches should be stored out of reach from children, especially babies and toddlers. Some doctors treat children with nicotine patches, but they probably use a lower dose. Mothers who are pregnant or breastfeeding should also avoid nicotine patches unless they are prescribed by their physician. When it comes to patch placement, avoid sensitive areas like the head, neck, and chest. Placing the patch on the areas like the right calf or thigh can help regulate dosage and minimize side effects like tachycardia. Placement on more fatty tissues will also lower and/or slow the dosing. Speaking of dosage, start low and go slow. It's recommended not to exceed 3.5 milligrams initially, even for former smokers. The reaction the first week is the strongest, but the body should adapt. Remember, everyone's tolerance is different, so find what works best for you. More is not better. The best dose is your sweet spot, where you maximize benefits with the fewest side effects. For some people, that is 3.5 to 7 milligrams, but others can't stand more than 2 milligrams, while some need 14 milligrams to notice anything at all. To cut or not to cut the patches. The two main types of patches are reservoir and matrix. Never cut a reservoir patch. Manufacturers warn against cutting any patches at all. To regulate the dose of nicotine patches safely, peel the plastic backing and cut the backing, not the patch. Apply the patch to the bicep area, securing it with medical tape. Hold for a minute to warm it up and warm up the adhesives so that it sticks better. And you're good to go. Cutting patches isn't advised due to the risk of nicotine leakage, which can lead to overdosing and severe illness. However, some users on the Facebook group report cutting patches for convenience and comfort, but it's crucial for you to understand the potential dangers and limitations. Search our Facebook group to see which brands might be safely cut based on the experience of other users. But of course, we do not recommend going against manufacturer guidelines. Dosing. So first, go slow and low. Don't push hard in round one. Just get used to the nicotine and find the best dose for you. Don't hesitate to take the patch off or to seek medical attention if something does not feel right. Now let's address some of the common concerns. Side effects like nausea and headache are typical, especially at first. It's essential to pace yourself and listen to your body. Vomiting one time or having loose stool for a day might be okay, but continuous issues are a sign that the dose is too high. Other signs could be tachycardia, feeling jittery or shaky, etc. If you experience anything severe or concerning, do not hesitate to seek medical attention. When you take off the patch, it takes 1 hour, maximum 2 hours for the nicotine to be out of your system. In addition to using nicotine patches, it's recommended to stay hydrated and take electrolytes like magnesium, especially if you experience headaches. While some suggest using binders to eliminate toxins from the body, they are generally unnecessary and may not address the root cause or discomfort. Nausea and other side effects can often be managed by reducing the nicotine dose rather than relying on binders. It's also advised to avoid supplementing with choline while using nicotine patches, as it can compete for the same receptors in the nervous system. But some people use choline during breaks. While additional supplements aren't typically required, it's essential to research and consult with others before starting any new regimen. Speaking of dosage, don't rush it. Slow and steady wins the race, especially during the adjustment period. And never stop or start other treatments without consulting your doctor first. It's all about finding the right balance for your body. And please, don't test more than one new thing at the same time. You don't know for sure what is causing issues if you're trying more than one thing at a time. Known medical risks and side effects. You can search on the internet and various web pages that will have various lists with the typical side effects that people experience while using nicotine patches. All right. Even smokers who are using nicotine patches, who are used to nicotine, will have these side effects. First, make sure you are familiar with these so you can distinguish them from Herx-Burks sickness reactions. The most common side effects I see are nausea, nervousness, and red or irritated skin. The skin irritation probably comes from the adhesives, and it affects about 1 in 10 people. See the FAQ files for detailed suggestions on how to remediate this problem. We will have to make a separate video on this topic. Now some risks that are specific to long COVID and ME, which you won't find on traditional websites. First, POTS, MCAS, and small fiber neuropathy. These conditions are quite confusing because some benefit greatly with reduced symptoms, and others feel worse. So I'm not sure what's going on there. Second, skin irritation. This appears to be more common than the cited 10% in the literature, maybe as much as 15%. And it seems that more expensive brands are more likely to cause issues. And another point is that long COVID and ME are more likely to be sensitive to medications. So take that into account when regulating the dosing. And one specific risk to nicotine patches is a burst of energy, which can then lead to a crash or PEM. Almost everyone experiences this at first. Try to pace and increase effort slowly. Next, the baseline is more likely to fluctuate. If you're going up and improving, you're more likely to go up and down and up and down. All right. So this makes it harder to pace because you're not sure exactly where your baseline is. Next, addiction and dependence. All the literature shows that nicotine patches are not addictive. But if you see benefits in baseline, it can be harder to stop and risk sacrificing those benefits. Herx-Burks and sickness reaction. If a sickness response is your goal, many people will say, oh, I want to have the Herx sickness response because then I'm sure it's working. If that is your goal, then make sure that that doesn't last for more than a day or two so that your body has time to recover, because healing takes energy. In conclusion, nicotine patches are not a magic pill, but they can be a helpful tool in managing long COVID, MECFS, and similar conditions. Some people even credit nicotine patches with helping them completely recover. However, even for them, there are many pieces to the healing puzzle. Just remember to approach it with caution, listen to your body, and always seek professional guidance. And above all, be kind to yourself, then help others when you have extra energy. We are stronger together. Thanks for watching.